Hello, everyone. It's Dr. Bonnie Acorda from Ontario, Canada. Sorry, I have to wear my toque. It's so cold here, and our heater is not working. I'm at the sunroom, and it's at nighttime today. It's early in the morning, but I'm so grateful to have one of our doctors and one of our consultant in Prive International. I have with me one of our guests, Dr. Joey Sinchioco. I hope I pronounce it right, Doc. Dr. Joey Sinchioco.
Right.
And he's a medical doctor. Dr. Joey, tell us about yourself before we start.
Yeah. Hi. Thank you, Doc Bunny. Hello, everyone. Whatever time it is in your own countries, it's afternoon here in Manila, and good evening, midnight in your own country. And thank you for standing by with us. I am Dr. Joey Sinchioco. I'm happy to be called Doc. Then I am a practicing OBGYN and high-risk pregnancy perinatology. And then I added aesthetic medicine into my practice early 2000 because that time it was predicted that health and wellness will be the in thing for 2000. And it's happening. And then when my father passed away, I took over his practice of family medicine, but I did some studies on functional medicine, which I am using right now, because I deal with chronic diseases, weight loss, cancer patients, something like that.
Wow,
Yeah.
Thank you for that introduction, Dr. Joey. Now, my next question is, which we know is very, very interesting, is how about getting of knowing and you being introduced to this amazing revolutionized device that we have called ITeracare? How did it come about, you knowing this product? Could you tell us about your story, Doc?
Oh yes. I'm the type of person who is very much interested in new technologies when it comes to health and wellness. In fact, the very reason why I attend international conventions and conferences is I want to see what's the newest technology in relation to health and wellness. Like even if this is a gadget or something that you use to diagnose, I'm very much interested. And I always ask the presenter, is this available in the Philippines yet? And if they say no, okay, let me be the first one. Okay. So there's some business side to it, but being the first in the industry with a new gadget is really amazing. And we wanted to offer more to our patients with less expense and with an immediate effect.
Correct.
Okay, and then I was looking at the internet. In fact, to be honest, I was looking at the internet, searching for technologies, and I came across with the word ITeracare. And I made researches about the testimonies. In fact, I even had to call one of the clients because he got healed with this arthritis. So, and he told me, yes, with 2 sessions, it's gone. And it's been there for decades. Oh, really? Then, so I click on the button, contact us, and Mentor Ana Ileto happened to answer. So we met, and I was there in the office in Galleria. They showed me the gadget and they tried it to me, and I was amazed because the first time I told Master Vince Valencia that I'm feeling sleepy. I told yeah, because that's a good effect. All right, I drank the terahertz water, and it's really different. The taste is different when you structure the water. Okay, so I did more research. No, I'm not the type of doctor who is skeptic because I'm always open to new technologies.
Exactly.
Okay, so so I said, okay, let me get hold of one item, one device, so I can try it to myself and to my patients and my family. Okay, so I got the classic, So I tried it on my patients. But what is amazing is that I did this application, the blowing to my youngest daughter, who happened to be complaining of right upper quadrant pain.
The quadrant pain.
Okay. Yeah, she has to call me from school because it was it was debilitating. The pain is so severe that I have to see her, pick her up, and gave her IV analgesic. It was so sick, so I suspected something, liver or gallbladder. True enough, when I did an ultrasound, there were 4 pieces of 1 cm gallstones, cholelithiasis. So I thought of ITera. Okay, so I did one week, no complaint. Of course, just like kids. So she felt better, so she had to eat again and again and again. So after 2 weeks, the pain came back. I have to do another ITera. Okay. On the 4th session, I noticed there was no more complaints. He was not calling me from school. So I said, that was after the 4 sessions. So I had to do the ultrasound again to check. Lo and behold, what happened? No more gallstones. There were 4 pieces of 1 cm gallstones and no more gallstones. So I even have to ask my technician to have it checked again. And she said, really, there was no gallstone. And I was so happy. And it was sustainable because from that time on, my daughter never had any more complaints. And I'm so happy about this. In fact, I also gave her the terahertz water. The terahertz water happens to be my favorite now.
Correct. That's really true, Doc. Yeah.
Yeah. And then, of course, I'm doing functional medicine. So if I may add another patient of mine, he's a 59-year-old obese, diabetic, and because of his weight, he developed osteoarthritis of the knees.
Correct. Yeah.
Okay. So he has to walk with a cane. He has to have knee pads and abdominal binder so he can walk. Okay. We did a 30-minute routine, and I had it in video. He was able to walk without the cane, without the knee pad, and he was walking. But slowly though, but he can walk. So I asked him, okay, this is what we're going to do to help you. You have to lose weight because it's your weight that's giving you the trouble on your knees.
That's right.
All right. So, and then, this is not placebo effect because 2 weeks after I visited him, he was still walking. And the 3rd week, I was surprised. I met him in the mall.
Wow. It's amazing.
And said, I can drive. I did drive. So I said, I was so happy. So this is something that is not placebo effect because, you see patients more often and you see the effect and it's long lasting.
Wow.
There were many amazing experiences that I have with my patients. If I can add one more, this is a 90-year-old. This is a 90-year-old bedridden for 2 years because of stroke and diabetes. Okay, after 2 sessions, she was already giving her testimony that she was already up and about. Okay, very active. The aura is different. So I was happy because some relatives are already ready to give up. And you come in, you make the patients happy. Being able to walk again at 90, and that's amazing.
Wow.
Nowadays, I'm sorry to tell that, sometimes when you're 70, 80, people will always say, oh, it's okay, it's already a blessing, it's already a bonus when you're 80 and 90, you're still alive. But what quality of life can you offer?
Exactly.
Nowadays, we talk about, if you follow David Sinclair and Breca, Gary Breca, they will now talk about longevity. Okay, means that you are 80 or 90 and you don't have any illnesses. Okay, that's how it is supposed to be when you talk about quality of life.
Exactly.
And I believe that our ITeracare system, I call it a system because we already have a lot of products, including the water, helps us. Okay, so I am a believer of ITera. Okay, I'm not. I've seen how it works, and I always say to people that I talk to, I am a doctor. Okay, but I see how it helps other people. So why couldn't I use it? Simply because it's not part of our conventional medicine practice.
Correct. Yeah.
Okay, so I have to use it. In fact, I can bet on my physician's license.
Yes.
Okay, that it really works.
Correct.
Okay,
Correct.
then show me a negative effect, and
Mm-hmm.
there's none. The
Exactly.
only the only the only effect that you see is on diabetic patients that have burns, a little burn.
Mm-hmm.
Okay, because they're not feeling anything when you
Exactly.
do the blower,
They're numb.
especially on the legs. But
Mhm.
other than that, you don't see any side effect. There's not even an overdose
Correct.
with the use of ITeracare.
Exactly.
And
And
that's amazing. I'm very, very happy. I was able to came across this technology, and I'm very happy.
wow. If I may, Dr. Joey, any personal experience like directly that you felt when you use it, could you share those with us? Do you have any?
Oh yes. Well, I, I'm not a dentist, but I happen to have toothache on the way I was driving,
Uh-huh.
and I'm having a toothache like 7/10.
Mm-hmm.
I was driving home. I said, okay, this is it. This is the real test because it's my personal. Okay,
Yeah.
7/10 is quite painful.
Mm-hmm.
So I didn't take any anti-inflammatory. I didn't take any analgesic.
Mm-hmm.
I have to use the Itera for 15 minutes. It was a classic.
Okay.
After the first treatment is gone,
Holy moly.
no more pain. No more pain. It's just a simple toothache.
Exactly.
Okay. Now another one is cough.
Cough.
It's flu season. It's
Yes.
flu season. I
Mm-hmm.
have I have to blower on my throat, directly on my throat with open mouth. Okay, inhale,
Mm-hmm.
exhale. So I have to do that. So and gone. It's gone
Like on the first session?
on the first session.
How many minutes did you do that?
10 minutes because
10
I was
minutes.
opening my mouth, and yeah, 10 minutes.
Yeah, that happens to my
Yeah,
wife. She's got some triggers of asthma a little bit, and especially right now,
yeah.
it's so cold in Canada. That's why I'm wearing my
Mm,
top. I don't have a heater running right now in this room, and
mm,
it's freezing. And
right,
that's amazing, Doc. I mean,
right.
I'm just grateful to know you personally right now, but looking forward to see you in person when I go back to the Philippines. Now, another
Oh,
question.
I'd be happy to see you here,
Oh
Doc
yeah,
Barry.
likewise, likewise. And if I may, I have another question. Now that this technology is out there and it's creating a buzz in different parts of the world, in UK, in Africa,
Right.
right now South America is growing little by little. We're trying to open South America, and we haven't even opened Korea
Mm,
yet. And right now,
yeah.
over 70 countries. Now, whether they're in the medical field, people that are in pain, whether even doctors do have pain as well, just like
Yeah, of
American
course. Of course.
other
We're also human.
we're all humans. Now,
Yeah.
having said that, some of them might probably have known about this device, the amazing revolutionized ITeracare, but still they're putting their mind on the side. What would you say to them, like your comments?
Okay. Well, it's really a matter of trying to experience, you know, the difference with a conventional practice of medicine and this device, the technology. We call it the technology. It's true when Albert Einstein talked about the future of medicine. He said the future of medicine is frequency medicine. In fact, if you notice on the internet, on the website, this is not the only technology about frequency medicine. In Canada, there are patches there are patches that can stimulate your stem cell.
Correct.
Okay,
There are.
there is a right machine that gives you different frequencies based on the different medical condition. Like you
Mhm.
have a different frequency for sleeping, you have a different frequency for abdominal pain, for heart disease, and those are true frequency medicine technologies.
Mhm.
Okay, there are even what you call the bracelets that
Mhm.
emit, okay, frequencies and makes you feel better. Okay, all of these are true. All of this works in their own different ways. It's just a matter of experiencing. It's not which one of the best, but which one works.
Mm-hmm.
Okay, so you really have to experience this. Well, I've met people, and in fact, I met some colleagues who asked for RCTs
Wow.
of our device or
Mm-hmm.
RCTs. So I said, it's a different thing because this is not a medical device. At
Correct.
least in
Correct.
Canada, it is,
Mhm.
right? So I'm very happy. In fact, it should be a medical device here also in the Philippines because that gives you a leverage on how good the product is.
Mm-hmm.
Okay, so we just have to come up with a lot of studies, because testimonies remain testimonies if not done in a great number of experiences.
Mm-hmm.
Okay, so it remained to be a testimony. It remained to be an experimental device, but at least in Canada it is. All right.
Um,
So now
well,
what I'm saying is, yeah,
I'm sorry, Doc.
yes, doctor.
Well, in Canada, we're not recognized as a medical device yet, but somehow there's some on the works of going towards that. But as of now, right now, the good thing about us in Canada is that they've recognized it as a home appliance therapy device, not a medical device yet, but a
Okay,
home
I'm sorry for
appliance
that. Yeah, my mistake.
home appliance therapy device, just like the heat and cold
Mm,
sensation
right,
that
right.
we put in,
The red light.
the red light and so forth. But hopefully in the future we would be recognized as such as medical device. But in the meantime, not yet. But we're getting a buzz right now
Okay,
in Canada. And the good thing about this
okay.
is that the government knows that we're here and we're here to stay to help those in need, especially those with pain and inflammation. And the good thing about that is that
Okay.
um, it's a good start in that, and hopefully I'm looking forward and I'm crossing my fingers is that it's gonna snowball in the US, in the Philippines, is that the medical field and the industry would recognize our device as one of such amazing device that could really help. And of course, you have to be proven, and you have to prove that this device could work and will work. Otherwise, we won't be approved
Yeah.
and recognized by Health Canada.
Right.
That's the give and take of that. But hopefully
Yes.
soon,
Yes.
yeah. And
Yeah.
so
So I'm positive it's going to happen.
so do I.
Let's
So do I.
manifest on that.
Yes, yes, you're
Okay.
right, Doc. Right, Doc. And Doc, if I may, I forgot to ask you this question: is what was the worst case that you've had, and then when you used the ITeracare device, lo and behold, were you amazed of that such case that you've seen in one of your patients that you thought like it may or may not work, but you've seen it that it did work? Could you share us about that story that you have?
Yeah.
Otherwise, if
Okay.
yeah,
The one of the most difficult patient to treat is a non-believer.
oh yeah,
Okay. So
correct. That's right.
it's a non-believer.
I do understand.
Uh,
Yeah.
this is a cancer patient,
Okay.
about 67 year old with breast cancer.
Mm-hmm.
Okay, so because I always talk about this in my Zoom, that my number one requirement is for patients to believe that they will get healed.
Correct.
If you don't, if the patient will not believe you, that if they do not believe that they will not get healed, then it's very difficult to
Right.
put a step forward. All right, so and then number two is that it is a change of lifestyle.
Correct.
Okay, you cannot just get the Itera every day and not following a proper diet.
Mm-hmm.
We always incorporate this with sun exposure, with grounding, with food. So I had some difficulty trying uh, uh, to came up with the proper protocol for this cancer patient because, well, uh, I cannot blame her because as cancer patients have tried everything
Mm-hmm.
but didn't work. and they would say, "Oh, this is just another
Mhm.
technology, another treatment modality that will not work."
Mhm.
Okay, and then after 2 months, she was able to see a difference in the size of her lump in the breast.
Mhm.
So because I always have a before, I see to it that I will always have a before and after picture,
Mhm.
and it happened. One of the three tumors shrink in size. The other one disappeared,
Wow.
and the pain was gone.
Diminished.
And it took me 2 months to do that, and now she's starting to follow my instructions. Okay, yeah. So and the other difficult thing is that even the relatives who talk to me are non-believers.
Mhm.
So to me, that is really a challenge.
Correct.
But of course, we don't give up.
Of course.
Yeah, it always, yeah, we always take that as a challenge because we've seen this kind of patient in our practice for the longest time.
Mhm.
And true enough, if you feel that you're right, if you feel that you can help this patient, then why not? Okay,
Correct.
it's just a matter of time, right? Okay,
That's
so
amazing. That's
to me that was one. That was one of the most difficult. Yeah,
wow. It's all starts with the mindset. And if you
right,
believe,
right,
you attract it. If you don't, then you're sending a different energy which may not help you. You know,
yeah,
we need to have an open mind for us to receive that energy. It starts right.
right, right, right,
It's our faith, of course, you know.
right.
And
Because the moment you touch your patient, you feel the energy, you feel the vibration.
mhm,
Well, to
mhm.
me, that is something. So I say, oh, this is a patient that's negative that I have to work a little more,
Correct.
to keep the healing process going.
Correct. Thank you so much, Dr. Joey. And
Oh, you're always welcome.
any parting words before we wrap up our podcast interview?
Okay. Well, this is my second, always my second to the last slides of my Zoom presentation. Uh, Always think that the best investment is always health.
Correct. Yeah.
Okay, health is your best investment.
Mm-hmm.
Health is your always the best gift for yourself and for your family. Valentine's Day is coming up and
Mm-hmm.
coming.
Mm-hmm.
Don't think about anything to give or to share to your loved ones, but the ITeracare system, any of the ITeracare will be the best investment and will be the best gift for your loved ones. Okay, because the effect of a healthy body and healthy mind, you cannot put money into it. Okay, you can be 20-year old, you can be 30 and even 90 with a good quality of life by using just this technology. I call it the ITeracare system.
Wow.
Okay.
That's
So we want you to share it with your family, to share it with your loved ones, and let us know your experiences, and we'll be happy to help you in any way we can. Here, Doc Bani is doing this right now. Oh, I'm so happy he's with us. Thank you, Doc Bani.
thank you as well, Dr. Joey. And if I may, each and every one of us, for those who are watching us, um, each and every one of us, including whether you're not a medical field expert or you don't have any knowledge about this device or whatnot, we all deserve equality of life. And there will always be a
Right, right,
solution, and there is hope. And one of these hope is this device. If you're in discomfort, you don't feel good, well, there's a solution. There will always be a solution. And one of those is this device. Thank you so much,
yeah.
Dr. Joey. And for
You're
those
welcome, Doctor.
watching us, this will be posted in YouTube. And last words, Doc. Could you share with our audience, for those who might be asking us later on, some people will be asking us, could you share with our audience where could they find you and any of your schedule
Okay.
or where at?
Uh, yeah, I have a page for the ITeracare. It's called ITeracare M.D by Dr. Joey. You can use it, or you can go to the website of Prive International, and my name will pop up there. So you can always text me. My messenger unfortunately isn't working, and it's not open to everyone because it's private. But the ITeracare MD by Dr. Joey is open, and I always see it that I answer all the inquiries, okay, even at late at night, because I feel that when people will text me and inquire, it's an ASAP, an ASAP thing,
Correct.
and they would need help.
And Doc, are you open to share your location, like your clinic? Would you be able
Yeah,
to
okay.
share with the audience?
Yes, of course. I work with Slimmers World and Premier Drip
Okay.
Clinic. We have branches in SM North, EDSA. We have branches in SM Mall of Asia, a Via Lifestyle Center, and Soho Building in Bonifacio Global City in Taguig City. Okay, so you can open our website, Premier Drip, okay, and then you can message that to us, or just email me at Joey Sinchioco MD at gmail.com.
Wow, that's
Yeah,
great,
I'll
Doc.
be more than happy to. Yeah,
Thank you so much, Doc. Thank you for your time. I'm so
you're
much
welcome, though.
grateful to have you on my podcast as one of my special guests as a medical doctor. Thank you so much, Dr. Joey.
I'm sorry. Thank you,
Uh,
doctor. Thank
and
you, doc.
thank you for all of your time and your contribution in the industry and in the frequency medicine, which is the future of medicine, as
Thank
per
you.
Albert Einstein.
Future of
So
medicine.
much, Doc.
Thank you, doc.